Hello, good evening, everybody. I don't know whether I am audible because Instagram is an entirely new media for me. Previously, I had tried to conduct 2 or 3 lectures on Facebook Live, but Instagram is something entirely new. So I do not know whether I am audible. Anyway, this is up 9:30. So today, the topic I have selected, that is the rheumatic remedies. Yes, the rainy season is now, and it is continuous in all through India. And after a lot of waiting, it had arrived in our state, Maharashtra too. Now, when we speak of rheumatic remedies, so we actually incorporate a long list of diseases. Because in homeopathy, disease or name of the disease does not take a good or important value because we believe on symptoms. So when we speak of rheumatic disease or diseases, rheumatic remedies, it will include all the things if it is not special cases. Because pain in joint, there was a case I can still remember. So there was pain in joint and there was huge swelling at the knee. It was a boy of some 8-9 years. And after seeing it, it was very difficult for me to believe that how the boy is tolerating so degree of pain. But when we inquire, it was not that much painful. So naturally, our suspect what actually had happened to this boy. And later we know the boy was actually suffering from hemophilia. So it was a hemophilic arthritis. So that's why I mentioned if it is not spatial. So then our materia medica elaborates the rheumatic complaints in same way. Gout, rheumatism. Many of the words are vague. Many of the words really do not go with the, what I must say, the acute condition or the disease condition of the patient. So when we speak of rheumatic remedies as a whole, so then we have to take for granted we have got two conditions. One condition is a chronic state, the patient is having pain, deformities, swelling. The pain is continuous, swelling is continuous. The pain and swelling is episodic. That it increases in every full moon and new moon. And for that reason why you have to select a homeopathic remedy, so that is obviously no doubt constitutional, anti-miasmatic, etc. But at the same point of time, when the patient is coming in acute severe pain, doctor, my organ or my joint is paining that much that it actually disturbs my night sleep. I cannot sleep through the whole night. And because there is a pain, I need some urgent relief from it. When we study the constitutional or curative remedies, we get a long list. Right from aprotinum, that is benzoic acid, oxalic acid, Actia spicata. Osteoarthritis no so. Rheumatoid arthritis no so. In various potencies and various degrees. Sometimes series of remedies. There are a good number of drugs, for example, radium bromatum, the famous homeopathic remedy, Rastrox, Bryonia. Antimiasmatic drugs like cephalin and metodinam, they are of tremendous help in treating a chronic case. But when the case comes as acute exacerbation, because there cannot be acute in case of rheumatic problem unless it is due to injury. Generally, after fall, the patient comes to you, and many a time we have to treat it as an injury. Otherwise, in most occasions, the rheumatic problems are the acute exacerbation of some chronic illnesses. And when the patient comes with such severe pain, we have got a bundle of homeopathic drugs. They actually relieve the patient from the acute complaints and acute problem whatsoever. One of the remedy where the Mathematical writes it is a remedy for acute articular rheumatism, means the pain of the joints. They are writing it is aggravated by touch and motion, something very close to our Brownian modality. But along with that, they are writing there is profuse sweat along with the complaint, and there is copious food sweat too. So we are getting a drug like Brownian modality, and it has got acute pain, and the concomitant is profuse sweat, and they are writing sweat in the feet. And the drug is salicylic acid, a tremendously good remedy for acute inflammatory arthritis. And we must remember, paracetamol contains salicylic acid too, that is actisalicylic acid. Even we have prescribed several times paracetamol 200 as an experimental basis whether it acts. But it doesn't act because homeopathy acts only when there is symptom similarity. And because the paracetamol have got no such kind of recorded proved symptoms, so it didn't affect it. Paracetamol acts in several different conditions, so that is a chance if we get to speak about sarcoidosis, we will talk about it. So it is a great remedy, salicylic acid, in case of acute articular rheumatism. Another remedy, because here we are more concentrating on the acute remedies to combat the acute inflammatory conditions. So it is another great remedy where they are writing in the very first line of Bodix Mathematica, an arthritic medicine, a remedy for gout and rheumatism, acute outbursts in gouty persons. And they are writing two very important concomitants. One is rheumatism comes with suddenness and restlessness. So we are getting a drug very close to rust talks. So here we are getting suddenness and restlessness. We know rust patients are restless. And another concomitant they are adding, that this patient has also got sweating, but the sweating does not relieve. So in our previous remedy we got a drug similar to the Brownian modality where copious perspiration that relieves, and here the drug where the perspiration does not relieve. And it has got something very close resemblance with that of rust. And the drug is Formica rufa. Formica rufa is a remedy we all know that is prepared from ants. And here we may think of the characteristic resemblance of these orthopods. Orthopods means they have got broken legs. So quite naturally, probably due to this reason, the orthopods, because they have got several breaks in the joints, acts nicely in the joint. Yes, formic acid is there, no issue on that. But formica that really relieves acute pain. Because when you speak of rheumatism, that may be due to anti-nuclear antibody, anti-DNA antibody. So a lot of immunological disturbance might be there too. Even in such conditions, these small remedies, if symptom collaborates, acts brilliantly and beautifully. So we must remember the name of Formica rufa. Another remedy, though it is used in mother tincture or very lower potency, and it is one of the very costliest mother tincture also. So they are writing it is a case for both for acute and chronic. We have got result in acute and chronic, both the conditions. But because it is not well proven, so you cannot depend that much on such issue. So they are writing it has got strong action on fibrous tissue. Remember, our Metromedica speaks which kind of tissue. So they are writing it is on fibrous tissue. They are writing arthritic diathesis, rheumatism, and tonsillitis. Anyway, tonsillitis is not our topic. They are writing a remedy for secondary syphilis, and they are writing very valuable in acute rheumatism. Now here again they are telling about free foul secretion, an unclean odor from the whole body. So this drug smells uncleanly, it's bad smell. A very good remedy for the acute conditions. And the remedy is guaiacum. We generally prescribe in mother tincture doses or 6 or 30 very low potencies in repeated doses to relieve acute complaint. But the issue is it is very costly, but it acts tremendously good. We had a case of a patient where already deformity started, where we had prescribed guaiacum mother tincture to relieve his acute pain with other constitutional remedies. Especially we prescribe aurum metallicum most probably to this condition. And really it had helped the patient as a lot. Now when we speak about this rheumatic remedies, how it is coming out. For example, we have seen the patient that is telling, Dr. Sir, I cannot flex it. If I try to flex my joint, there is severe excruciating pain. So my hand is always extended. So pain is severe, swelling is there. If the pain is aggravated on flexion, the drug is very uncommon, but it is listed in Kent's repertory. The drug is physostigma. Unbelievable. Because physostigma is a remedy for tetanus. Physostigma is a remedy for eye complaints. How the Metromedica read, how we have studied from Metromedica. But here physostigma is a remedy for that condition. So if it is flex aggravation, physostigma. Extended aggravation, quite natural. That is, they are writing Ferrum metallica. Now we must remember, for shoulder rheumatism, Ferrum acts marvelously. Ferramate is for left side. Ferramure is for right side. When you think of sanguinaria, so we can think of Ferramure. Sibylinum is obviously there. We have got good bunch of remedies. Solanum lycopersicum. That is also a rheumatic pain in acute complaint, especially with influenza or corax. Solanum lycopersicum. Another remedy that occurs in the people related with games like repeated jumping, say basketball players, say the table tennis players, say the fast bowlers who jump, So if there is a repeated jump, we can think of several remedies. The patient comes with a pain at the heel. We have got remedy like strontiana, we'll talk later. Strontiana carbonica. We have got arnica, no doubt of this. We have got drug like calcarea floor, that is in 6x repeated potency, 2 or 3 times a day. That really relieves the complaint. But I want to put one remedy at your dictionary, that is Distripa sylvestre. Another tremendous good remedy, especially when repeated jumping brings the injury and causes the pain. Because injury causing the pain or repeated heats causing some difficult diseases. You may see the case of most probabilities of Sarabhai Kapadi, I cannot remember. So there he is giving a jockey Ruta for his rectal carcinoma. And you observe, in our Mathemedica, Ruta is considered to be a remedy of rectal cancer. But his analogy was, the person was jockey who runs the horses. And horse has got a gallop. And so he is considering there is repeated injury at the rectal region. And the case was marvelously getting cured by this particular remedy. So this analogy, we have to think, we have to join it. Otherwise, for solver rheumatism, we have got the drug like Actia spicata. And I want to add another remedy to this. That is Lacnanthus. Lacnanthus is a tremendous good remedy where we get the pain, stiffness that is occurring in a shoulder rheumatism, or what we call in cases of acute conditions of cervical spondylosis. We must remember to give acute relief to the cases. Now in another remedy, though rarely used, but in our practice we have seen a tremendous beneficial result. This drug writes remedy for rheumatism, muscular pain, and again they are writing inflammatory rheumatism. We must remember our Mathemedica writers couldn't get the chance to study the advanced pathologies in today's language, but they understood the phenomenon. I said before, acute inflammatory rheumatism. So this inflammation obviously says some autoimmune conditions occurs in seropositive and seronegative rheumatoid arthritis both. So they are writing it is acute inflammatory rheumatism, joints swollen, painful, and here they are writing a very precious word. There is a tendency to metastasis. So we can remember our great remedy for metastasis, where the rectum is involved or the lower GI is involved with rheumatism or alternative rheumatism. The drug is aprotenum. So where we are thinking of aprotenum, if it is concomitant with that of rectal complaint, aprotenum acts nicely. But here they are writing there is a tendency to metastasis. Means it is a fleeting polyarthritis. And you can remember the drug like Calmia latiflora. A fantastic remedy, it clear cut writes the rheumatoid arthritis with that of cardiac complaints. Because in advanced case of rheumatoid arthritis, we get cardiac problem along with rheumatism. And the drug is Calmia latiflora. So in such conditions, when we are thinking about Calmia latiflora, we can think of the drug, and again you concomitant is profuse sweat. So sweat, I feel, has got some relation with this rheumatism because repeatedly it had got mentioned. And the drug is Rhamnus californica. Another fantastic remedy. And you can prescribe it in a bigger potency, 200 for 2 or 3 days, repeated doses. It really relieves the acute pain. Another remedy a bit different from all the aspects. They are writing the joint is swollen. They are again writing fibrinous rheumatism, stiffness. Here we are getting osteoarthritis of the knee, periarthritis, left hip fixed arthritis, etc., etc. Rheumatoid arthritis, knees, ankles. This remedy is a bowel nosut. Bowel nosut was introduced in homeopathy by Patterson. Few of the books of Allen's keynote in old version, original Allen keynote. It is not Rhiannon's Allen. So there they have attached these 7 or 8 drugs prepared from the bowel nosut. One very important is Morgan Gartner. We use tremendously psychotic compound remedy, and that is for chronic pyelitis, pyelonephritis. And especially the lady is having history of repeated urinary tract infection. So the drug was psychotic compound. And here, for joint, what we have gone through now, joint swelling, and there, writing all the clinical conditions, we can use this remedy. The drug is Bacillus number 7, or popularly Bacillus 7. Generally, bowel nosuts are prescribed in high potency, that is after 1 m or 1 m at least, and frequency of repetition is obviously less. So what the instructors told us. So Bacillus 7. Another fantastic remedy. There are remedies like lithium carb. The person having pain with stiffness and he has got some urinary complaint, lithic acid diathesis. Lithium carb is a remedy for acute rheumatism. If the person complains of pain with swelling, renaissance and aggravation, pointing to a particular area, drug is Kali bichromate, a tremendously effective remedy for controlling rheumatic problems. And we never remember, should always remember, when there is lightning, thunderbolts, renaissance and aggravation, swelling of the joint with stiffness, rhododendron chrysanthemum. Another fantastic remedy to combat acute rheumatic problem of the people. Another remedy, not very frequently used, but still of tremendous good acute result. This drug has got typical crackling sound in the joint. Cracking sound. We know in case of rheumatoid arthritis, we repeatedly tell the patient, extend your knee, whether it creates a sound. If it creates a sound, the person has got a limping gait, so it is 100% a case proceeding towards osteoarthritis. So here we are getting crackling sound in the joint, and the person has got irresistible desire to get coffee. The drug is Angostura vera, a very good remedy for such condition, like that of your asafoetida. The pain, joint, in bones aggravated at night. The drug stands is mesoreum. Generally, when the complaint aggravates at night, we think of mud salt, but never forget mesoreum. And if this mesoreum, if the patient has got some kind of skin complaint with rheumatism, mesoreum acts like a miracle. You will get tremendous relief of the bony pain, like asafoetida. So it is Angostura vera, crackling in the joint with irresistible desire to take coffee. Another remedy. It is a constitutional remedy, A tremendous good effect it has been shown even in case of acute joints. A very good remedy for pain in tendo achilis, that means heel pain. Generally for heel pain we think of the remedy like Arania diadema, a spider. Arania diadema. Here we'll be seeing the asthma or the problem of breathlessness relieved by smoking, a peculiar symptom. That medicines like Hecla lava, Calcarea flow, and this is also a remedy for acute heel pain. But when the patient having rheumatism with hypertension, our teachers taught us, when there is a family history of hypertension, the 2-3 generation history of hypertension, and the person have developed this kind of rheumatic complaint. And when the patient has got sequelae of hemorrhage, naturally in one patient you are not getting all these complaints, but this is for the information purpose to make you understand what is the depth of the remedy. Chronic sequelae of hemorrhage. If the person has got some hemorrhagic tendency and if hemorrhage is creating some complication to this person, high blood pressure with rheumatism, and the patient is strongly chilly, and the pain is relieved by hot application. So opposite to leader, where you will be getting a cold amelioration and diagonality of symptom. But here, the pain is relieved by warmth or hot application. The drug is strontiana carbonica. Apart from this, because the time is short, for handling acute rheumatic complaints, pain especially, we have got remedy like, generally these are given in mother cincta doses. That is curcuma longa. It is prepared from turmeric, and we all know turmeric has been used since centuries by Ayurvedacharyas for acute painkiller. If there is injury, the turmeric mixed with calcium carbonate, and that is pasted over there, a plaster used to it. It's a fantastic remedy for that. Another remedy I want to add to your list, that is equisetum. No, not hyemale. Equisetum hyemale is a different remedy. It is equisetum aravans, another tremendously good remedy to combat acute rheumatism. The remedy harpagophytum, another good remedy combating acute rheumatism. Some of my friends, they are strong favor of prescribing bambusa, probably for this some similarity doctrinal for acute rheumatism, but for me, I have got tremendous result. The drug is Boswellia serrata. Boswellia serrata. Sorry. So this remedy, few days back I was searching allopathic drug for acute rheumatism is given to me. For rheumatism, the drug was given by some allopathic physician. It is allopathic remedy. But the content was with chondroitin sulfate, with collagen. They are using these two drugs, Boswellia serrata and curcuma longa, as a content for the cases of joint pain or osteoarthritic changes. So this remedy acts beautifully in combating acute rheumatic problem and chronic problem. The only way, you have to go with series of remedies with anti-miasmatic, constitutional, whatever name you give. But for acute remedies, there should be a totality. however small it may be, with two symptoms totality, even a single symptom totality. But unless you have got proof symptom, the medicine is not going to act. So thank you so much for your patience, listening and hearing. And in another Friday, we will come up with some new topic. So thank you so much. Good night. Take care.